Hello, everyone. Welcome or welcome back to another session of A Day with Your Fertility Specialist. I'm your host, Joanna. So, today we're just very thankful that you're here. We always appreciate every engagement, every click, every like, every share. And on that note, we would want you to share this with someone that needs encouragement today. It's another testimonial Friday. So, you know that we have good news coming your way. And today we're going to be talking about a woman living with PCOS or polycystic ovary syndrome, which is something that we've talked. And if you're interested in that topic, then you can go on our page and look at our previous sessions where we spoke about PCOS. So yes, she had a lot of downtimes and difficult situations, but like every testimonial, there's renewed hope, right? It's a story of hope, expert care and just having that encouragement all around you. She had had multiple IVF cycles that were failed, but due to that one referral that she had that brought her to Alps hospitals, she actually had good news come from that. So today we are joined by Dr. Deborah Olubi. Welcome, ma'am.
Thank you, Joanna. Always a pleasure to be here. Good afternoon, viewers.
Yeah. So Dr. Debbie, in case you do not know, is the IVF head coordinator here at Alps Hospital. So who better to tell us this story than someone who works with these people in tandem, with our clients in tandem. So yes, Dr. Deborah is going to put us through this. I will be reading out the story and we'll have a few little inputs here and there so that you understand a lot more about how this process goes. So, Dr. Debbie, we
Yeah.
have this story today talking about how the right referral changed
Mm.
everything, right? She said she was diagnosed with PCOS in her mid 20s. Her menstrual cycles were irregular, sometimes completely absent. Ovulation was inconsistent, and month after month, pregnancy just did not happen. And this PCOS affected not just her body, but her confidence, emotional well being. And, each negative test just made her even more afraid that motherhood might not be possible.
For her.
So, yes,
Yeah.
how do these symptoms? You see them quite a lot in your journey with your clients.
Yeah, so PCOS is one of the commonest cause of infertility or subfertility. It said that 1 in every 10 women have PCOS.
Okay.
That's polycystic ovary syndrome, and it's something we
Yes.
see a lot. It's a common cause of infertility. So what happens in PCOS is that there's an hormonal imbalance, some metabolic abnormalities that leads to a woman not to be having frequent ovulation.
Okay.
In a normal woman, you should ovulate every month.
Uh-huh.
Yes, but with polycystic ovary syndrome, these women do not ovulate every month. And it presents with symptoms like you said, irregular periods or sometimes even absent period. You see some women going 6 months, no
Wow.
menses, no
Wow.
periods. Yes. Some it could just be that their periods are less frequent, maybe
Mm-hmm.
menstruating every 2 months or 3 months. But for some women, they could even go completely a year without menstrual
Oh,
cycles.
that's
Yes. So
interesting.
they're not bleeding. So apart from the infrequent or absent menses, you also see them presenting with other things such as acne. You see some of these women have a lot of acne. They have a lot of hair in places that a woman usually does not have hair, like facial hair, hair
Okay.
on their abdominal wall, hair on their legs.
Mm.
They could also present with other things that you see when you do further testing, like on scans. Their
Okay.
ovaries are usually large,
Oh, wow.
and then you see they have multiple cysts, lot of small tiny cysts all over the ovaries,
Mm.
and this happen because of the infrequent menstruation. So they are not menstruating, then these cysts form all around the ovaries. And then when you do some laboratory investigations, there are some hormonal imbalance that you see.
Yeah.
There's an imbalance between the LH. LH is especially at particular times of the menstrual cycle, when FSH, that's the follicle stimulating hormone, that's the hormone that's involved in developing of the eggs,
Okay.
in the initial stage.
Okay.
So you have another hormone, luteinizing hormone or LH, that is now higher later on in the menstrual cycle when it's about time to release the egg or ovulate.
Mm.
But there's an imbalance between them.
Okay.
So you see that the LH is higher than the FSH. And the FSH is what you need to develop this follicle. So
Yes.
those are some of the things you see in this woman,
Mm.
both from the symptoms they present with, and when you do further evaluation, the scan, you do lab testing. So those are some of the ways they could present. But
Mm-hmm.
the presentation would depend on the degree of the
Okay.
polycystic ovary syndrome. Yeah, there are
Okay.
people that have polycystic ovary syndrome, but they see their menses every month.
Hmm.
Yes, the fact that you're menstruating doesn't mean you're actually ovulating.
Oh,
Yeah, so they
okay.
could still have issues with fertility.
Hmm.
So it's not that okay, I think maybe I'll allow you to continue the story. So those are the ways. So you have women that they're seeing their period every month, but when you investigate them further, maybe they
You
present to the hospital because of they're not getting pregnant. You now see that they have PCOS,
PCOS.
so it's not just the symptoms. You look at the biochemical features, you look at the ultrasound features to make a diagnosis of polycystic ovary syndrome.
Yes, okay, that's really interesting, and you've gone quite in depth with
Mm,
that.
mm,
I'm sure as we go on with the story, we're going to see our clients having a lot more of these things that she can, relate to. And this actually does put a downer on your clients. Here she says she tried naturally for
mm.
over 2 years, tracking
Okay.
ovulation, changing her lifestyle,
Yeah.
supplements,
Yes.
prayers, even, and nothing worked. And it was just a heavy weight on
Yeah.
her health emotionally and, even physically. And they just knew that they needed this expert help, but did not really have that
Yeah,
direction
yeah.
on where
So
to
you
go.
mentioned she said they tried lifestyle changes, supplements.
Yes.
Yeah. So
Mm-hmm.
like I said, PCOS comes in with different severity. Some people just have a mild form of it. Some have moderate. Some have severe. So
Okay.
some of the ways we treat her sometimes lifestyle change
Mm.
because a lot of women with polycystic ovary syndrome are usually obese.
Mm-hmm.
They have some metabolic, it's not just the hormonal imbalance like I mentioned, there's also some
Yes.
metabolic disorders. They have high level of insulin in their system. They have
Wow.
what we call insulin resistance. Some of the ways we can treat apart from lifestyle we encourage them to lose weight if they are obese.
Mm-hmm.
If they're overweight they should lose weight. And then we encourage dietary change. More of vegetables, fruits, less of carbs and fats and oil.
Yes.
Yes, and then exercise also helps. Exercise helps to lose weight as well.
Mm-hmm.
So apart from that, supplements, like I said, there are some metabolic abnormalities,
Mm-hmm.
there are some hormonal abnormalities. So some supplements can help also to correct
Okay.
some of these abnormalities. So
Mm.
supplements, different kind of supplements, I won't want to name them here,
Yeah.
can be tried,
Mm-hmm.
yes, to try to correct all these abnormalities that is preventing ovulation from happening regularly. Yeah, so for some women that works. You do that and then pregnancy happens spontaneously.
Yeah.
But for other women, you might have to still go further to try other things.
Mm,
Yes,
okay.
one of the other things that can be tried is what we call is a surgical procedure, laparoscopic ovarian drilling.
Okay.
Yes, so laparoscopic ovarian drilling, I mentioned that they usually have large ovaries.
Yes, you did.
So these large ovaries is producing a lot of excessive amounts of male hormones or androgens.
Hmm.
Yes, so a woman shouldn't have an X amount of androgens. Is part of the problem in polycystic ovary syndrome,
Okay.
preventing them from ovulating. And one of the ways you can try to control this excessive production of androgens by the ovaries is by reducing the mass. This
Hmm.
large ovary they have, reducing the mass, the size of this ovary. So that's what you do when you do laparoscopic ovarian drilling. So you're
Okay.
trying to reduce the mass of the ovaries to reduce the ovaries from producing this
Those
androgen. So
hormones.
holes or some of these tissues are destroyed as a way
Hmm.
to control this abnormality in the hormones, this
Yeah.
hormone production. So
Okay.
that's another thing that can be tried. And then we should know that polycystic ovary syndrome is a chronic condition.
Hmm.
So we don't have a cure. All these modalities are to manage it.
Okay.
Yes. So when you do all this and a woman is still not conceiving or not getting pregnant spontaneously, and you ruled out other causes of infertility, then she might need assisted fertility.
Yeah, I can
Yes.
imagine. Yes, she
Yeah.
did mention that she had had some failed IVF cycles in this journey, and so that made her a little bit more
Okay, she had
unsure.
failed IVF
Yes,
cycles. Yeah.
unsure of where to, go and where to start. But then she actually had someone close to her that was able to set her, would I say, on the right path, right? She said her sister-in-law came and spoke to her about Alps hospitals that she had actually heard about. It's not like she even had a
Okay.
direct experience with Alps hospital, but she heard about it and just encouraged her to come over here and to seek care here. Just speaking about the experience that she had heard from other people and was just confident in that. And she says the referral changed
Our life.
everything.
Yeah, information
Yeah,
is power, especially right
exactly.
information. It's very powerful.
It is.
Yeah. So IVF, so fertility, she has had a lot of, you mentioned that she had some failed
Yes.
IVF. Yeah. So IVF in clients with polycystic ovary ovarian syndrome is also challenging because
Hmm.
one of the problems you have with them is poor quality eggs. So
Okay.
it's not just doing an IVF that is a solution. We must put in modalities in place to try to correct all these abnormalities that
Yes.
already exist in their system. So it's not just doing an IVF that's the solution. You must try to correct this background hormonal abnormalities, metabolic abnormalities,
Yeah.
yes, even before the IVF. That's what will optimize the chances of success
I
with
can
the
imagine.
IVF, yes.
So that's actually a good thing that she, came over here. As you can tell,
Yes.
Dr. Deborah has a lot of experience with this, and she might not have had that happen in other, places where she had her IVF done
Treatment,
and,
yeah.
didn't have that. Just basically optimizing your chances at
Exactly. Yeah.
conceiving. So she came into Alps Hospitals, and from her very first consultation, things just felt different. I mean, you don't need to go multiple times to know from her previous experiences and then what she had with Alps, things just felt different. And she felt listened to, number one. And PCOS was explained to her clearly and
Yeah.
outlined in her own personal fertility journey, which I
Yeah,
think is very
very
important,
important.
actually.
Yes,
Yes.
yes. The patients shouldn't just be treated blindly. Carry the patients along. Let the patients, for the patient to even make decisions, they need to be informed, well
Yes,
informed.
that's
Yeah,
true.
that's a lot of what we see. People have procedures being done to them or done on them and they don't know what the procedures are or what they were for. I don't
Yeah.
think that is correct. So the client must be carried along. Give the client all the necessary information they need so that they understand what is happening. When a client is better informed, they are better able to take your counsel and whatever the outcome, they better understand why those outcomes are
True.
the way they are.
Yeah.
Yes. So I think giving the client the right information is very important.
Okay. Yeah, that's true. I think that as well. So, as she got on this journey that was very personalized, because every fertility journey is personal to
Yeah.
you. You can't be the same as any other person's journey. She was reassured that PCOS does not mean infertility.
Yeah, it
Yes,
doesn't. Like I said, there are different. A lot of clients with PCOS still get pregnant
so
spontaneously. Yes.
exactly. If you do struggle with PCOS or you've been diagnosed with it and it feels like the whole world is crashing on your shoulders, it's not a the end of your fertility journey. It doesn't
Yes.
mean that you cannot, you know, achieve those your dreams of conceiving and being a mother. You just need to have a more personalized and specialized care team around you. And she was counseled that her IVF outcomes are can be managed properly.
Yeah.
Like I said, PCS does not mean infertility, but just because of the risks around the syndrome itself, like you've explained, you have a lot of things that can actually affect
Yeah.
your
The egg
fertility.
quality,
Yeah, exactly,
especially
your
egg quality
quality,
of eggs.
exactly,
Yeah.
and things like that. So she had to have her treatment protocol carefully tailored and every step was monitored closely, which is something that is actually very important here at our hospital. Every step is monitored because whether there's success or failure, which we always hope for success,
Yeah.
you want to know how everything went and how we can do better because our growth also means our clients' growth. So yes, she started her IVF journey and responded well to stimulation, which I'm sure is a process
Yes.
during the
Yes.
IVF process. So
Yes.
she was able to have some eggs retrieved from her own eggs, and had them fertilized, and she actually got up to 4 good quality eggs according to her. So is this
Good
something that
quality
is,
embryos at the end.
yeah,
Yeah.
oh right,
Embryos.
embryos.
Yeah.
So is this something that you said your patients should be informed through every procedure so they actually know exactly how many eggs and
Yes,
embryos and
yes, yeah,
everything they get?
yeah. We carry
Wow.
them along. They're
Mm,
told, Madam, you had egg retrieval. This number of eggs were gotten. This number fertilized.
wow.
These are the number of embryos we have. These are the gradings of the embryos we
Oh,
have.
okay, wow.
And then they could make their decision on
On
how
how to
many they
go.
want to have transferred. Yes, they are guided through their treatment. They are
This
told, how the treatment went. Yes, they're not left in the dark. Yeah,
that is very reassuring
yeah,
actually, to know that everything that you're doing is actually being told to you and you're not going about blindly. It also helps to give that sort of calmness that
yeah.
is
So
required
it
during
gives
that.
them a sense of belonging, that they are part of the
Exactly.
process. Things are not being forced on them. They are
Yes.
carried along, because a lot of clients actually want to be carried along. These are adults, yes. Yeah, these are adults, so they should be carried along. So we carry them along. They know
Okay.
what is happening. Even while we're monitoring them, during the IVF process, we tell them what we're seeing.
Yeah.
You have so number of follicles. This is what we're seeing. This is not going as we expected. You're going slowly. You're going to, we carry them along. So,
Wow.
nothing is
That's
done behind them, so
yeah.
that when decisions need to be taken, they are in the best position to take the best decision for themselves.
That's amazing.
Yeah.
That's really amazing. So she had her four good quality embryos and proceeded with a frozen embryo transfer.
Yeah. So,
Now, this is something else that I think we need
yeah. And I
to.
think why she had a frozen embryo transfer was because, apart from, despite the fact that she had four good embryos at the end, we retrieved a lot of eggs from her.
Hmm.
Yes, and that's something happen with clients with polycystic ovary syndrome.
Mm-hmm.
Their bodies could react excessively to the drugs, and you could get a lot of eggs from them. And because of that high number of eggs, they are predisposed to have something we call OHSS, or ovarian hyperstimulation syndrome. And
Okay.
this is when you have a lot of hormones raging in the body. The
Hmm.
ovaries are enlarged, the ovaries are leaking fluid into the
Oh
abdomen.
wow.
Yes, and that's not the best embryo. That will be what informed the frozen embryo treatment she was counseled for.
Hmm.
When a client has OHSS, that's not the best environment to transfer embryos, because that process, with all the raging hormones, progesterone is so high, estrogen is so high,
Yeah.
it shortens the implantation window.
Okay.
Yes, they have a lot of there's leakage of fluid into the intra abdomen peritoneal cavity,
Hmm.
and they present with a lot of symptoms like abdominal bloating, pain. Some, depending on the severity, could even be vomiting.
Okay.
So that's not the best. There's a lot of fluid in the system, and some of this fluid can track back
Hmm.
through the fallopian tube into the lining of the womb, endometrial lining. And then when you place an embryo, that fluid could even
Just.
flush out the embryo,
Oh
preventing
wow.
implantation. So when a client develops OHSS, we usually counsel that we shouldn't have a fresh embryo transfer. So
Okay.
we'll counsel them that let's freeze the embryos,
Mm-hmm.
allow your body to recover from this process. Then we
Hmm.
plan for a frozen embryo transfer, which I'm
Okay.
sure it will happen in this client.
Yes,
Yes.
I'm just going through this, and she actually did say, because of her risk of ovarian hyperstimulation,
Good.
right, due to PCOS, she had
Yes.
to have a frozen embryo transfer to optimize safety and
Success.
success.
And success.
Yes, so
Yes.
she said when she did that, she felt more. How would I say, her treatment was more intentional. It felt
Yeah.
like it's the
We're
treatment she
looking
got
out.
at.
Yeah, we're looking out for her. What would
Exactly.
increase? It's just not just about, going through the cycle. The
Mm-hmm.
aim is success at the end. So whatever
Yes.
it is that would increase a client's chance of success is what we always do. So yeah, we might think it's cumbersome, having to wait, but if that will lead to success, then it's
Of
better we
course,
wait.
yes, of course.
Yes.
Sometimes good things take
Yeah,
time. Yes, you
exactly.
might have to be
Yes.
patient a
Yes.
little bit, but you know, just like, oh my goodness, we're getting ahead of ourselves. She said the waiting period was emotionally intense, and she has done she has tried to conceive naturally. She has had IVF cycles before, and she had negatives in her
Yes.
pregnancy tests.
Yeah.
I'm sure she felt very tensed while
I'll be on
waiting.
now. I'm another wait.
Yeah,
Yeah.
exactly. So she said she hopes, but she was also cautious, didn't want to allow herself feel that hope that yes, this might actually be that turning point for her.
Yeah.
And when the pregnancy test came back positive, she was completely overwhelmed. After years of PCOS and uncertainty, IVF worked. That is
That's a
such
good
good
one.
news.
Yeah,
Yes,
yeah, and
it's
we've seen that working. That strategy of freezing the embryos and then coming back to have a frozen embryo transfer, leading to more successes in recent times, really with our clients.
yeah.
That have PCOS, that develop OHSS. We've done that a lot. And another thing I just want to chip in is that it's not all clients with polycystic ovary syndrome that must have an IVF. The
Mm-hmm.
other, fertility treatment they can have that could lead to them conceiving.
Yeah,
So it's not everybody that must have an IVF. So the client is evaluated. The fact that you have PCOS doesn't mean it must be an IVF you would have.
it's true.
Come for your evaluation. Some clients, it might just be placing them on those supplements, lifestyle changes, and they're able to conceive spontaneously.
Okay.
Some could do things like ovulation induction. Some it could be an IUI. It depends on the particular the
Yes.
peculiarities around the client.
Mm-hmm.
So a proper evaluation is a starting point. So don't think, oh, I have PCOS, so I'm constrained or compelled to have an IVF. An
Yeah,
IVF might not be the solution. For some of them, it's an IVF they would need, but some might need just some other forms of fertility treatment, not necessarily an IVF.
IVF. Yeah.
Yes.
Okay, well, that's interesting.
Yeah.
So, in case you're thinking, oh, IVF is to this or it's to that, it's something
Yeah.
that you're
Yeah.
not on board with, you should actually come over and speak to a fertility specialist, a highly trained one, and an expert in the field, so that you know what best of a decision you can make that would
Yeah.
lead to your success and overall your happiness, right? So this moment of her getting this positive test
Yeah.
really just
I can
confirmed
imagine.
to her
Yeah.
that she's finally achieved her dreams, and that one referral literally changed her
Yeah.
life.
Yeah.
Yes.
Yeah.
So honestly, we really do appreciate
All the
all the
referrals we
referrals,
get.
honestly.
Yes.
Yes.
Yeah.
And even this one is even more, how would I say, I'm even more grateful for it, because it's not like the person that referred her had a personal experience, but because of how good of an experience people that she had heard from did,
Hard.
she actually vouched for us, and
Yeah.
that is really an amazing thing to do. Thank you very much. So yes, pregnancy with PCOS actually would require careful monitoring, I'm sure.
Definitely.
Yes,
Yes. Yeah.
because the continued support of the medical team is actually really important, in that we don't just stop at the positive
No, no,
pregnancy
we don't.
test.
We
Yeah.
continue care.
It's
Yeah.
a journey. It's a
The next
journey.
few months, the
Mm-hmm.
clients, the pregnancy, the baby, the client
Yes.
needs very close
Close
monitoring. That
monitoring.
early stage of pregnancy need to be closely monitored.
Yeah. So yes, like I said, we don't just stop halfway with you. We go through this journey with you. And PCOS is not infertility. In case you have heard that being told to you over and over, please
Yeah.
just think, just that's a myth that we're bursting right now. And I hope that sticks with you. And all it takes sometimes is just one informed recommendation or one informed
Yeah.
decision. And if you've had a good experience, it would be lovely to share to someone. You never know who is waiting on that
Yeah,
information
you
from
cannot
you.
overemphasize that.
Yeah.
I was just talking with a colleague. She was
Mm-hmm.
just mentioning, there's a client that we had seen before and cancelled in a particular light. People believe their friends more than even you, the healthcare personnel,
True.
especially if
Yes.
that friend has had, a personal experience in that
Mm-hmm.
direction. We had cancelled her for something, and she was not really willing to accept this counsel. So I just heard information that, oh, she's coming back, she has accepted, she's
Hmm.
coming for the shoot. I was like, what happened? So she was saying that because her friend that had a similar issue and a similar
Hmm.
treatment talks with her,
Can you
she now
imagine?
received her counsel. So she felt, oh, I'm not even the only one that is going
Mm-hmm.
through this. You can
Mm-hmm.
see word of referral. You don't know what you do when you share. That we know there are people that sometimes hoard this
Information.
information, or some people even go to the extent of misinforming people.
Wow, that's
But this her
terrible.
friend, I'm so happy she could, because this was a very vulnerable
Yeah.
personal information that she shared with her friend
Mm-hmm.
to help her friend, and this has led to her friend taking the right decision.
Decision.
Yes. So proper referral, you can't underestimate what it does when people openly share the proper information
Yeah.
with their friends, with their colleagues, anybody, acquaintances, and so
Mm-hmm.
on. Yeah, so we encourage our clients, please share the good news. We know a
Yeah.
lot of people have benefited, from our services, have received answers to their prayers, achieved their conception and pregnancy dreams.
Dreams.
Please share the right information with those around you.
Yes, yes, actually, please
Yeah,
do that. So, yes, this is not just a testimony of a successful IVF treatment, it's also a testimony of the people around you and the information that they share with you. So yes, we really do appreciate you for sending in this story. Thank you,
Yeah.
Dr. Debbie, for enlightening us along the
Thank you for
way.
having me. Always a
Yes,
pleasure to
ma'am.
be here.
Always. So
Yeah.
yes, PCOS is not the end, and this story is just to give you hope, right?
Yeah.
And we do this just because you might be going through something and you want to hear from someone who has also been in a similar situation as Dr. Debbie has said. It's easy for us to sit here and ramble on. You might think, oh, this person is the doctor, oh, this person is this. They're
Mm.
just saying it because it's
Yeah.
their job.
Yeah.
But this is something that actually works. And, we hope that this has given you some hope about whatever situation it is that you are in. Please stick around with us. We have these testimonials coming up a lot more. And if you didn't hear about something that you think you struggle with, you might hear about it in the future. But
Yeah.
before that, please plan that visit to House Hospitals today. Just come in and see a fertility specialist. It's not going to take anything from you. In fact, it's going to improve your chances if I do say so myself. So, yes, thank you for sticking around with us. As always, we do appreciate you staying until the end. And if you did share this video with someone, well, thank you for that. And if you joined because of that, I hope that this has been informative for you and this lights up something in your heart today that your infertility, your fertility journey is not hopeless. It is not something that is the end of, your dreams and the path that you want to go on. So yes, have a wonderful day and we hope to see you next time. Bye.